Hello, Dr. Berkson. So,
Hello.
so good to see you.
Oh, I hold you dear to my heart. I love getting to hang out with you for a while and then inviting the universe and others in on our whatever we'll cook up with our conversation.
You're the only one I don't really like to plan for because I know all we got to do is merge our mind, do a mind meld, and off we go.
Like a Vulcan mind meld, right? Remember the old put your hand
Exactly.
like that?
Uh, Here's what's on my mind these days: the mind and how it relates to women and hormones and toxicity as well. Would you field those two subjects and just go off on what you think of hormones in the mind and toxins in the mind?
So I'm a dancer and I love West Coast swing because it's improvisational and your partner gives you a either even a breath or a movement and you take off in response to that. So I love this conversation. It's somewhat like that, but we're wordsmithing and building a conversation together. So it's not dance, but it's like a dance. What's extraordinary to me is that for years everyone was frightened to death about the big C, cancer. Now so many people have had cancer, it's not quite the extraordinary diagnosis it used to be. And we're now worried as we live longer about the second big C, which is cognitive decline. And if you go at this time to any gerontologic symposium, any, you will not see in any, I just ate lunch, I wanted to make sure I didn't have a piece of spinach hanging from my front tooth. You will not see on the docket anyone talking about hormones. Yet the one neurologist, Dale Bredesen from UCLA, that has been replicating his work, publishing in peer review, and is really turning the Titanic away from the cognitive decline icebergs. If you have a mild or moderate case in under 6 months, one of the top things that he does is assess for hormones and get them on board if they're insufficient or out of balance. Why is this? Hormones give brain its volume and functionality. Hormones rule the brain. That's why my last book, in fact, was titled Sexy Brain, because the concept is that sex steroid hormones rule the brain. And part of aging, you have a decline in hormones and you have a decline in cognition. So I don't understand what this resistance is. And a few months ago, David, the University of Arizona did an extraordinary study where they looked at 400,000 insurees. And they looked to see who had been on hormones and who hadn't, and if they got cognitive decline like Alzheimer's disease, Lewy body disease, Parkinson's disease, or not. They discovered, which should have made headline news, that women on hormones had a 69% decreased incidence of Alzheimer's disease. But if they were bioidentical hormones, all hormones helped, but bioidentical hormones reduced the incidence of cognitive decline by 79%. It's extraordinary. It's almost 80%. It's almost, it's so close to 100. It's extraordinary. Did that get picked up by gerontologists? Did that get picked up by neurologists? It's extraordinary to me, the role of hormones keeping the brain healthy and synapsing, and our resistance to turning that Titanic away from the icebergs.
I know it's so extraordinary. And then looking at it from a whole other perspective, I can, having specialized in treating women in menopause with compounded bioidentical hormones for 28 years, it must be 75% minimum, and you'll have your own figure for this, of the women who come in for their first visit have got some kind of cognitive issue going on. And it's one of the drivers of them making that appointment. They're starting to not think clearly. They're having trouble working They are involved in complex professions and they can't function like they used to. They're not remembering this. They have significant cognitive decline. Some of them have very serious cognitive decline. And then for a lot of them, not all of them, within a month or 3, or maybe even 6, put on a good individualized hormonal program, they're thinking clearly again. And they just love it. They get to have themselves back again. So it's such a common experience for anyone who's ever treated women.
It's extraordinary. This is, why are hormones in this rabbit hole? I mean, the other thing that people are very much into these days are genetics. So patients walk in your door and they go, oh, kind of like a brownie badge or an Eagle Scout badge. I've got the MTHFR gene, or I've got the ApoE4 gene, which makes me vulnerable to Alzheimer's. I'm scared to death. My mother had it. My father had it. And all the while, testosterone in Japanese literature that's been replicated over and over again in the past 15 years has shown that if you have your testosterone levels as you age in the normal to higher normal range, it shuts down epigenetically the expression of these Alzheimer vulnerability genes. So much so, that's one of the reasons women are more prone to dementia than men are, because women have less testosterone on board. And yet, when you think of hormone replacement, most of these studies look at estrogen, progesterone. They don't look at testosterone. We have 22 countries, I don't know the exact number, around the world now giving hormones for free when women age and hit menopause, because they've tracked the benefit and see how it protects their socialized medicine coffers, but they don't give testosterone either. It's the misunderstood hormone. I was just speaking in Charlotte, and a very well-known hormone educator and medical doctor, stood up when I was talking about the benefits of testosterone, because it protects the breast, it protects the two Bs, the brain and the boobs. It protects the breast against proliferation, so it is protective against breast cancer. Women who get breast cancer tend to have lower levels of testosterone than women who don't get breast cancer, and it also protects the brain. And she popped up and said, most women who take testosterone menopausally will get heart disease. I mean, it was just inaccurate, completely inaccurate. So even within our own circle of educators, there's a misunderstanding of the incredible role of testosterone to protect the brain and why these are not utilized, because it also protects muscle mass, and sarcopenia, the loss of muscle as you age, is a driver of accelerated aging, as well as brain, because recruited muscle sends out myokines that go and house clean the retina and the brain. So part of your brain and eye health comes from sustaining your muscle health. When your testosterone goes in the toilet, it's very hard to even get a response from your hard-earned exercise. So why are these things so hard to embrace? And they are science-based. They are in randomized trials as well as epidemiologic trials. I don't really, and they're not expensive.
There's such a misconception about that. Testosterone has so much been considered a male hormone, and it's not. It's a human hormone. A young woman, has more testosterone in her body than she has estradiol. And one of the most common things, as you've already mentioned, in aging, in fact, a gerontologist was teaching our senior medical school class, saying, you guys know thousands of diagnoses. Let me tell you what's really happening to the elderly. They are losing their muscle through a process called sarcopenia. And as you pointed out, that's primarily because of the loss of androgens, testosterone and DHEA, and they're losing their bones, osteoporosis. And the other thing about testosterone is I've been doing 24-hour urine hormone tests from anywhere from 3 to 5 months into treating women. And I can tell you there isn't a single woman 3 years into menopause that doesn't have very low testosterone. And my estimate is that 95% of the women these days are in the perimenopause, already strained because of dysfunctional response to stress, their androgen system, that they're already showing low testosterone and DHEA. 95% would be my estimate in the women in the perimenopause. So we pay as much attention to replenishing testosterone as we do anything.
And, we talk about endocrine disruptors or pollutants that compete with us for hormones, functionality. We think of it in terms of them being estrogenic pollutants, but there are many, many anti-androgenic pollutants that we are exposed to from morning till night. Just in personal care products in the morning in the bathroom, there's probably 60 or 70 of them. So we're seeing lower testosterone levels in males, and we're seeing altered and abnormal testosterone levels. And the other thing that people don't think of with testosterone, David, we all talk about how your immune system is in the gut, and that the gut is the mothership of your health. It all starts in the gut. Well, that immune system is basically made of secretory IgA, an immunoglobulin that licks what comes in from the outside world and tries to decipher with its tongue-like sensation of this immunoglobulin, is it friend or foe? And the secretory IgA that protects us, that's where most of our immune system lives, is really run by testosterone. It is an androgenic functionality. And part of the reason you want a healthy biome is some of the healthy bacteria make some androgenic molecules to help support that immune system. So testosterone is incredibly important for volume and function, where memories are consolidated and live in the hippocampus in the brain, and incredibly important for immune functionality. Men have more testosterone, which is why they have less autoimmune diseases, all except there's 159 autoimmune diseases known so far. And I think just the renal one, women have more than men. But it's really amazing that in the fragmentation of the genres of medicine, so you have a gastroenterologist, the cardiologist, the ophthalmologist, and you need them all. And we think that the gynecologist and urologist and endocrinologist, they're just going to be our hormone caretakers, but that's not what's really happened. And so many body systems are signaled and influenced by hormone wellness that those really smart, incredible doctors who don't understand the role of hormones in the tissue that they have their genre in do a disservice to their patient to not acknowledge that and have that be part of the testing and the treatment to make the patient better. It's really, you and I have been chatting for a while about how we want to put together a board certification program and help docs go through it so that we can, as we're healers and we want to heal this problem in the medical system, but nonetheless, it's so amazing what hormones do to the brain. And then, of course, the gut is the second brain, and hormones play a huge role there too.
Would you speak to two things? The specificity of environmental toxins signaling out androgens. Some are androgen specific receptor site toxins, and some are estrogen specific. I always thought they were non-discriminatory. They just bunged up everything they could get their hands on.
Oh, interesting. No, they're very specific. So, for example, like phthalates might be extremely estrogen disrupting. And the worst exposure is the egg and the sperm, and then the placenta and the fetal growth. That's your most intense potential adverse downstream effect. But you can still get effects when you're an adult. But specific chemicals have tendencies to sit on the satellite dish or the receptor of specific hormones. For example, and all the hormones are vulnerable. Oxytocin is extremely vulnerable. There's a lot of discussion. Are we so angry in America today? Not just because of political polarization, but because our oxytocin receptors are disrupted from Pitocin in the ER, all in the pregnancy ER, all the way to throughout life. And insulin, I was a reader on a World Health paper about 20 years ago with Physicians for Social Responsibility and World Health got together when diabetes was obviously becoming a huge issue. And I was a distinguished scholar at the estrogen think tank at Tulane. And we were looking at all the causations of this epidemic of type 2 diabetes, that 1 out of 2 Americans is at risk. So one of the portions of that paper was on the insulin receptor being so vulnerable to specific chemicals. So the male receptors, the female receptors, the oxytocin feel-good receptors, the insulin receptors, the vasopressin receptors, the adrenal receptors, the thyroid receptors, all of these hormones have receptors. They have promiscuity that they can signal into each other's receptor, but there are chemicals that have more leanings to sit on each receptor and disrupt the normal functioning of the hormone signaling.
Name a few and tie them into commonly used household products or environmental exposures.
Oh gosh, let me see if I can. I think
you mentioned phthalates. The common source of phthalates, the most common source of phthalates is?
Well, a big one for women is perfumes. Almost every single perfume has phthalate in it. And you go stand under a shower and get all your pores open, and then you put your perfume on before you leave, and you just push it right into your body. Phthalates, of course, phthalates give flexibility to plastics. So anything that is, bicarbonates are firm, rigid plastics, and phthalates are very light plastics. The worst phthalate exposure comes if you microwave food in plastic containers like those. You buy food, even health food, in little trays, and those trays are plastic, and then you microwave them. That gives a lot of endocrine disrupting compounds into the food. And if you wash in the dishwasher plastic containers and then reuse them to even hold water or food. One of the biggest things that happened when I was a distinguished scholar at the Center for Bioenvironmental Research, where I had the honor of meeting and hanging out with the thinkers in the field of hormones, and also hormones merging now with the environment, was I don't know why I constantly forget this scientist's name, but she took a little plastic container and rewashed it in a dishwasher with regular detergent that wasn't green detergent. And she put water in it, and she fed that water, just water. She fed that water to pregnant rodents, and the next 4 generations were infertile. They didn't have to be exposed. Again, it was only that one exposure, so that endocrine disruption, part of the fear of scientists, is its transgenerational effect being passed on to the next few generations, even with one exposure. So you really do not, I have in my book, Hormone Deception, the last third of the book is and that's why that book is how I got invited to be a scholar. In a 3-month period, when the world didn't know about endocrine disruption, nobody knew about it. I spent 6 years working on that book because I realized that this was coming down the road. So in a 3-month period, 3 books came out that really shook the shoulders of scientists and also the lay public. And it was Our Stolen Future, Hormonal Chaos, and my book, Hormone Deception. And we were all saying hormones rule us. They make the human race continue, and they're under attack from the environment. First seen in wildlife, but then in this. So the last third of my book is, how do I get this stuff out of me? How do I protect my family? So how do we protect your supermarket cart, your home, and your office? So that was that first book on that I wrote. And then, of course, I wrote another book on the environmental threat of sexual castration by lowering testosterone levels in men and altering in women. We have menopause in young women in the form of polycystic ovarian syndrome. And we're really in the gender bending. When I was at the think tank, our big question was, will chemicals that are ubiquitous in our environment cause gender bending? Because Lou Gillet, who sadly died about 2 years ago, was an embryologist from the University of Southern Florida, and he was in a polluted lake doing research, Lake Apopka, and he started to notice that male alligators looked like something was wrong, and he was a he-man, and he caught them and tied them to surfboards, and he measured their penises, and they were small, and he cut them open, and they had ovaries and eggs, and the males were being masculinized, and the females were being feminized, and the water was polluted, which is why we think he got lymphoma, unfortunately, and died. But then they remediated the lake, and all that reversal changed back again to normal. So Gore came to our think tank. We wanted to raise money to test chemicals to see which chemicals were endocrine disrupting, because fertility and gender identity and things like that were being affected, let alone brain function and many aspects of physiology. So he is famous. He is famous for his line. He testified at the Senate House Senate, I don't know the name of it exactly, the House Committee. I'm not sure of the name of where he testified, but he stood up and he said, every man in this room is only half the man that his grandfather was, and what will our children be? Because our hormones that rule, we started out with the brain, they rule the brain, but they rule everything southerly from the brain. They're under attack from the environment that we now live in.
Yeah, this is something to pay such great attention to, and to put it in practical terms. And I heard someone on a YouTube talk say that, like it or not, if you want to be healthy, you have to become a radical environmentalist. You've got to start in your own home and do everything you can to clean up your food, your air, your water, your cleaning supplies, and you have to go all the way. And if you do so, your life is going to become less expensive for you and more delicious. Yes, you're going to have to purchase organic food or grow a garden or both, but what you save on dry cleaning and your household cleansers and stuff. So it's a call that there's a remedy here for your personal life. You don't have to be perfect, but you could have a 2-year plan where in 2 years you cleaned everything out in your cupboards, in your laundry room, and you're only using simple products, just a few of them, that are free and clear of as many chemicals. If you see a chemical name on something, that means you get rid of it in some environmentally safe way, if such a thing exists. So that's the call to action. You can do this. I've done this. I heard about this decades and decades ago, and it freaked me out because I saw the medicine about it, and I saw what was happening to people, including the whole thing that happened to alligators, because I spent some time in Florida, and I heard about this. Thanks for bringing that to our attention, the importance of cleaning up your act.
Yeah, just your biggest exposures in the house, and your shower is one of the biggest exposures, because water treatment plants do not remove many, many things from metabolites of pharmaceuticals and birth control pills and on and on. So you need to get an inexpensive, on my website, I like a Berkey shower filter, and it costs $50, and you can change it every 6 months. So I just have a little link for people to purchase it easily, because that's a biggie. Just that alone, just getting a shower filter would reduce your exposure to carcinogens and endocrine disruptors, all the things that make your brain shrink more, that we're talking about hormones try and protect against, but they damage the hormone's capability to be brain protective. So, Tyrone Hayes in Berkeley became the nemesis of the atrazine industry, because he would expose pregnant tadpoles to atrazine, which is sprayed on so many things. We spray more of it, I think, than any other country. And he could make them hermaphroditic or change their sex. So you got to say, I know every generation has their shtick. every generation's got their thing that they get identified with and that's really important to them. And gender fluidity is extremely important to many young people, but you got to wonder how much of it is sociological versus pollutionological. It's so interesting. So I always say to my patients, if they ask me if they've got kids that are wanting to change their identity, at least wait till after menarche and, after the hormones have come in. Then once you start taking hormones to change your sex, if you change your mind down the road because you don't know how you'll feel a decade from now, you'll have the choice to reverse it if you want to. But if you make that change before the hormones come in, then you really can't reverse it. So I think that's a big takeaway from that. At least that's what I've been told by physicians that run these clinics. This is not my specialty, but at a conference, I met a doc that ran these clinics, and she said this is a point she tries to get across to the parents.
Yeah, good one.
Yeah.
Talk about estriol. And I mean, when we think of estrogens, we think, well, sure, they relate to women. They relate to the female reproductive system. They relate to pregnancy. They relate to the breasts. But how about the prevalence of estrogen receptor sites, estriol receptor sites in the brain, for example? What's the prevalence of estrogen receptor sites in the brain? Just to get down to the biology of why this stuff is not just anecdotal, that estrogen's good for your brain.
What's really amazing, so your brain, a hormone, simplistically speaking, it can act in a variety of ways, but the basic way is like a lock and a key or a signal into a satellite dish. And wherever these satellite dishes are, the hormone's seeking out to send a signal, and the brain is filled with satellite dishes for estrogen, testosterone, progesterone, oxytocin. But the brain has many satellite dishes for the second estrogen receptor, beta, and they overlap on top of, if you look at where the beta receptors are throughout, like, for example, the gray matter and the neocortex, they overlap on top of the oxytocin receptors. So beta and oxytocin have a lot of intimacy, and they have a lot to do to keep you from being anxious and have anxiety disorders. If you're getting those signals to oxytocin and or beta, you have there's other hormones. I mean, estrogen, progesterone, testosterone, they all play a role. And the neurotransmitters, like little puppies, follow the hormones around. But nonetheless, it's very fascinating to me that beta is almost sitting right on top of the oxytocin receptors. If you look at a representative sample of where those docking sites or the receptors are. And beta is a calming, people throw out the word estrogen dominance as though estrogen is bad. So I chafe at that term because it gives a bad rap to estrogen when estrogen has many receptors. We don't even know what all of the receptors do yet. And the second receptor is a calming receptor, an anti-cancer receptor. In fact, the things that signal beta are very similar to the final metabolite of testosterone. And it's one of the reasons that testosterone protects the breast, because its last metabolite, 3-beta-diol, seeks out estrogen receptor beta and protects the breast against growth out of control. And it's another way that testosterone also calms the brain because it can signal beta in the brain.
And what's good to know about natural function in a young woman is during the menstrual cycle, there's two different functions. There's preparation for a possible implantation. And if the implantation takes place, you go on to pregnancy, including breastfeeding. In fact, that breastfeeding is prepared for right from the middle of any menstrual cycle. And that's under the direction, so to speak, or the inspiration of one major estrogen receptor site alpha. And in preparation, Alpha, estrogen receptor site alpha is a stimulatory. It stimulates the growth of the uterine lining so a woman will menstruate if she needs to. It stimulates the breast glandular tissue right in the beginning of the cycle to prepare for lactation, right at the beginning of each menstrual cycle. And if she does not get pregnant, then there's a deactivation of everything. The additional breast cells that were formed by proliferation, by actual cellular mitosis, by cell division, breasts get fuller during the second half of about mid-cycle. They deproliferate by a process so wonderfully named called apoptosis. And that's under the influence of estrogen receptor site beta. And the principal stimulant of the deproliferative is estriol. That's one of the three active estrogens. There's probably more, but that's one of the three. And why I'm emphasizing this is that any estrogen a woman can get is going to be better than no estrogen. But best case scenario, your provider is so knowledgeable about treatment that they're going to include estrogen receptor site alpha stimulant, estradiol, and they're also going to include estriol in your formulation. In fact, in a young woman, there's 4 times as much estriol as there is estradiol. There's 1.3 times as much estriol as there is the sum of the other 2 estrogens. So that's nature's design. We want to respect that, and we want to, as Dr. Wright, a friend of ours, so beautifully stated, look, let's not reinvent the human being. Let's copy nature. And so estriol is a very important thing to include in the best of the treatment plans for treating a woman. And there's a zillion, I don't know if exactly a zillion, plus or minus 20, estriol receptor sites, E3 receptor sites, estrogen receptor site beta in the brain. So there's probably a reason.
All blood vessels, all blood, the endothelium, heart disease is what mostly takes us out. A heart attack or a stroke, right? You want to keep your endothelium, the lining of your blood vessels, protects your heart and protects you against the most common reasons people get taken out to the next incarnation. And all the lining of the endothelium is filled with ER beta receptors.
Yeah, so we're mentioning this because best treatment plans include the major ER beta receptor inspirer, which is estriol, E3.
Yay. And the food that I got to talk for a second on soy, because soy is so maligned, man. Oh my God. I mean, if you really spend some time going through the literature, there's no debate. There is a massive body of literature. It's so enormous that it's hard to believe that oncologists still warn women who had ER-positive breast cancer to not eat soy because it's estrogenic. But soy is the one food, the one singular, absolutely extraordinary isoflavone food that mainly signals ER beta, that is cancer protective. And it's clear cut that for every so many isoflavones of soy that you eat a day, you reduce your incidence of primary cancers or recurrences of cancer. So soy is a food that signals this wonderful second ER beta receptor we're happening to chat about, that was discovered by Yanaki Gustafsson and Ken Koresh. I just spoke with Ken Koresh on a conference a few months ago when we were still doing online conferences, and he said something that kind of blew my mind. And it answered why I was able to reboot some women who were getting premature menopause. He said all ovulation is under the direction of ER beta.
Wow.
And so I had bumped into an article, because I'd like to wake up in the morning, and I'm such a nerd, and I love to go through the literature every morning. I've been doing that for decades. And I had bumped into an article on about 12 women, a small pilot study where they all had stopped menstruating at very early ages. And what the scientists did was they gave them 10 milligrams, or was fair amount of milligrams of oral estriol for a short period of time, and they all started menstruating. So because I read that article, if someone came in with me with premature ovarian failure, I've been trying to give them, normally we don't give estrogen orally, but because it was the way they did it in the study and it's only for 1 month, I replicated it. And sure enough, a fair amount, not all, but a fair amount of women started menstruating with that. And I've never kind of understood the mechanism. And then when Ken said, hey, all ovulation is under the control of ER beta. And of course, Yanaki he's Swedish from the Karolinska Institute. So he goes, ER beta in his Swedish accent. And he's been hired by pharmaceutical companies to try and make a breast cancer medication that acts exactly like soy and ER beta or testosterone and estriol. You can do it naturally, that protects against cancer. But of course, pharmaceutical companies want to make a compound that has a molecular structure never seen before so they can patent it. But they wooed him to Houston from Sweden. So he'd come to our conferences with a big cowboy hat on with his Swedish accent. So those two guys discovered the second receptor, and there's a third receptor. It's a transmembranous receptor, so it doesn't signal to a satellite, but instantaneously on the membrane. It's all over the nervous system of the gut, and it's the third estrogen receptor called the GPR estrogen receptor, and it's one of the reasons that women have much more tendency to get irritable bowel syndrome and gut disorders, because it's ruled by estrogen, and it rules the nervous system of the gut, which is why estriol calms that nervous system down, or soy, if you're not allergic to it, can calm that, or testosterone. You can use these hormones if you understand the physiology and treatment.
Going back to what you said about soy, I mean, long before we knew that there was an estrogen receptor site, there were studies done that showed Japanese women had a much less incidence of breast cancer than American women, and that a lot of Japanese migrated to the Hawaiian Islands. Right. And those women had a sort of a mix as far as they had an elevated incidence of breast cancer than the women who lived in mainland Japan, but not as much as the Americans. Women in mainland Japan ate a great amount of soy. It was a very fundamental part of their diet.
Right.
So, yes, I too am very.
And iodine.
Yes,
they have those the two major breast protectors, soy and iodine. They eat so much more iodine than we're all so frightened of. We're so run by fear here. I see, now all this stuff coming out on monkeypox, and it's unending. The presentation of everything. No wonder it's of course everything's multifactorial, but people are so scared, so angry, so trigger responsive in a not good way. And we just get so frightened and hypochondriacal about so many things. We are such a mentally ill country. I worry. We're healers. We want to heal and bring calm. We want to signal the ER beta of our culture, so to speak. And that's why I love opportunities to chat with you, because you're very healing just to even listen to you, David. You're very knowledgeable, but you're congruent and centered and spiritual. So people listen to you and they go away and they feel better for having heard from you and learned from you. And we try to add to the outrageous, enormous level of stress and angst that is out there. So I don't know why people get so fearful about so many things here. Some think the oxytocin receptor has been under attack by endocrine disruptors, and that's contributing to it. But it's really our goal. We're healers, to bring balance to our patients, and with environmental consciousness, to try and bring some healing and balance to our Mother Earth.
My favorite explanation for what's going on, and the model is physical again, it's like an abscess that's an infection deep in the body, and it's constantly trying to find the surface so it can evacuate itself and get rid of its pussy contents. And I think the human race has been repressing uncomfortable emotions throughout human history, fear being one of them, and anger and sadness and emptiness and loneliness and shame forever. And I think a hallmark of life during the time I've been on Earth is that there has arisen in America and all over the world people who really are seeking to heal. They want to become better people. They want to succeed at love. They want to have more fun. They're returning to simple values of what makes my day fun and interesting and enjoyable and fascinating. How can I contribute to the healing of this planet? There's been an uprising of millions of Americans that have invested time and energy and courage and their money into learning from the now thousands of mentors available who've been doing this work forever, that are guiding people into learning about their emotions and their mind and how to improve the choices they make in their day-to-day life and heal the shame that binds us, and thus want to take care of our bodies and make better health choices. So I really appreciate your compliment there, but I want to tell you, when I was in my 30s, I got inspired to become a better person. And I had the great good fortune of meeting up with teachers who taught me about my emotions and how to unearth repressed fear. So I think it's about abscess, and it's coming to the surface as never before. And it's nip and tuck about whether the planet's going to survive. But I'm by the number of people who are caring about this. You mentioned cardiovascular, and we have in our chat a question from Miranda, and I'd like to read this out loud. So do I need to have my arteries checked before going on estrogen, as estrogen can cause calcium to break off? I'm 62 and have never taken hormones. There's two answers, and I'd like to field this one, and then, of course, if you have anything to add. You know, in one sense, there is a technical issue there. Estrogen, as Devaki was pointing out, is so protective to the arteries. Young women do not have these unusual stories where she was 42 years old and she just passed out and had a heart attack and died on the tennis court. Whereas this happens to young men from time to time. Because the incidence of coronary artery disease is much less in young women who have their hormones. And the key is estrogen. But the incidence equalizes by the time women are 60. Then men and women leave Earth at the same rate from heart attacks. Half of us are going on, as Devaki said, into our next incarnation. And so estrogen plays a very significant role. And yet for a woman who hasn't had estrogen, you know, there's a number that's thrown out for 10 years, but every woman's an individual. We always individualize it.
That estrogen window concept is wrong. It is wrong. I want to throw that out. I want to take that gynecologist from Harvard, throw him out. I interviewed him on my podcast and I did not play that show. And last week, our National Institute of Health and our National Library of Medicine published a study that proves it. And that didn't make headline news. There were 7 million women in Medicare that were evaluated. 7 million women. And they looked to see if women had been on estrogen and if they had, what happened? Did they get cancer? Because everyone's fearful that estrogen causes cancer, drives cancer. Doctors think this, gynecologists think it. And can old women take it? Can't be taken by old women. So they looked at women 65 years and older that were on estrogen. So let's get rid of this window thing that bothers me, because you can give a woman in her 90s, but you might have to go very slow to honor what she's saying. But anyway, they discovered that if a woman had been on estrogen for 5 years, that she had a 33% decreased incidence, the same exact protective statistic that they found in the 19-year reanalysis of the Women's Health Initiative. By the way, how interesting is that? A decreased incidence of breast cancer, uterine cancer, ovarian cancer, and of colorectal cancer, and much less heart attack or strokes unless they took the hormone, the estrogen orally, which of course we have one of our people that's going out there. He's a well-known person. He tells everyone take hormones orally. And we've been talking about the potential procoagulative downstream metabolite issue, but they found that if you take your hormones orally, you might have a higher risk of ischemic stroke. But basically, older women and they lived longer. They lived an average of 5 to 10 years longer with less adverse acute events. So end of the estrogen window. It's just that you have to deal with women who've been off estrogen a long time in a much more nuanced manner.
Exactly. And we take we take an extensive medical history and we evaluate someone's cardiac risk factors. And if we see cardiac risk factors or coagulation propensities, we evaluate them. And then we'll address those. And then 9 times out of 10, we're going to treat.
How do you address those? So let's say you find somebody who she's a bit procoagulative. You think this might be a woman who might have some plaque. This is what she's saying, not the calcium break off, but plaque rupture. That's so Miranda.
That's the proper way to put it. It's not a calcium break off. It's a plaque
rupture. So say if you think that a woman is at risk of that, but you want to get her on hormones, what will be the little baby steps that you'll taper up with, David?
Well, every single woman and man is an individual, and we're always weighing risks and benefits. And one of the things I'm a big believer in is where there's an assessment that can be done that could affect someone's life, we want them to know about it and them to make the choices. You could have a woman that's 3 steps away from dementia and she's got some coronary artery plaque. And we evaluate the coronary artery plaque. The cardiologists have got some very sophisticated tests to see what kind of condition is that plaque in. And then that the window, by the way, of that plaque breaking loose is supposedly only a year. There's a lot of different ways to look at this. And the coagulation, we are in contact with these very sophisticated coagulation profiles that I teach about this. There's the coagulation mechanism has got many, many steps to it. And we can see which of the steps might be the cause of enhanced coagulation. But my God, you can quote thin somebody's blood with 1,000 different. So what do you do?
So what are your top 2 or 3 favorite tools to do that?
Well, I always start with omega-3, vitamin C, and vitamin E. And sometimes I'll add an enzyme like lumbrokinase until they bruise. You know, I look at the back of their hand, and when they start bruising, I know that they're getting bleedy. And then I'll have them back off. And 9 times out of 10, that's going to work. Now, if we want to do the sophisticated testing, we can evaluate, is someone moved from a state of enhanced coagulability to where they're now in a safe zone when we retest them. This is very crucial. If they are procoagulative and they've got arteriosclerosis, coronary artery, what kills people who have coronary artery plaque is the clot that forms. There's a friend of ours, you know him probably very well, Gary Gordon, once said to me when I pointed out I found someone with a highly sensitive CRP elevation, he said, yeah, but it's about the clot, stupid. And he walked me over to Hemmick's laboratory at one of the conferences. So we pay a lot of attention
Stroke scares me to death. I've had so many friends recently because you and I are both not spring chickens, and I've had quite a number of friends lately that have stroked out that have been doing a lot of things right, and they still stroked out, and now they're in a wheelchair. 2 years later, they still can't talk. One was an OBGYN published in peer review. And I mean, it's so I'm always thinking about ways to do everything right, but reduce your risk of stroke. I think this is a really good conversation.
Yeah, it's an extremely important thing, and that's why we chose to learn as much as we possibly could about clotting. Not all strokes are clotting strokes, but a lot of them are. So in America, in the delicate poised situation,
You froze, David. You froze. I think I've lost him for a bit. I don't know. Can people hear us? Can you hear? Pamela, can you hear? Because I'll answer your question until David comes back if you can hear. Can you write yes if you're there? So I'm not sure people can hear me. So I'm not frozen. Okay, great. So the question that Pamela had thank you, Pamela. The question that Pamela had was, can you take DHEA to up testosterone? So DHEA is a parent hormone in that it can morph into two different downstream hormones. One is estrogen and one is testosterone, but you don't really have any control over which is which. So usually if a woman is younger or perimenopausal, we use DHEA to try and morph and increase testosterone. But once a woman really is menopausal, it's really much better to use testosterone. DHEA doesn't work as well for the functionalities that we have been discussing as testosterone does. I'm hoping that we did the universe come and whisk him away because we were exposing too many truths. Let's see. David, where are you? Let's see if we have any other questions I can answer here. Did that answer your question? I think it did. And where did David go? Where did David go? Hey, do I feel like the bioidenticals are okay? Hey, okay. Do I feel like the bioidenticals are causing weight gain in my stomach? I purchased your supplements and I still feel the same. There is about 15% of women who gain some weight with bioidentical hormones or get a little bit bigger in the breast size, but they still feel so much better. And often they won't lose that weight. Many women, more women than not, like 75% of women often lose weight. And there's lots of studies showing that women that take hormones tend to have a narrower torso, not really Scarlett O'Hara, but a narrower torso. I would up the receptor detox maybe for 3 days in a row. I'd take 3 twice a day and see if that could break a little bit of the cycle. And I do that maybe twice a month or 3 times a month. And I would also want to work with somebody to look at other factors that were part of it. But about 15% of women will get benefits from hormone replacement, but gain a little bit of weight, where the majority of women will have a narrower torso with being on bioidentical hormone replacement. I have I have to battle a little bit of weight because I'm a diethylstilbestrol daughter, a DES daughter, and which is the most endocrine disrupting compound ever invented and was formally banned by our government in 1971 as a class 1 carcinogen. Papers are written that DES daughters are heavier on the whole. So when I started hormone replacement, at first I had a rougher time with weight. And then I figured out how to eat and do other things and design my products so that that problem went away. So often it is fixable, finding the right solution. Here's another. Oh, he's back. I know he is about women, but about males and supplementing DHA in the hopes it will pathway. Would that be age? Okay, so are you back, David?
I'm back.
I was trying to, on the fly, answer some questions while you were gone. And there was a question here at the top that you should address. Someone asked if you could take DHEA to up your testosterone. And I said, well, you can do that perimenopausally a little bit. It's a parent hormone. You don't know if it's going to go to estrogen or testosterone, but it's not as good when you're menopausal as testosterone. And then the response to that was, I know this is about women, but about males and supplementing DHEA in males in the hopes that it'll follow the pathway to testosterone. So she's asking, can you use DHEA to boost T in males?
Less likely that DHEA is going to convert to testosterone in males, more likely in women. But the bottom line is these things are so potent. All these gonadal hormones, whether they're ovarian or testicular, are so powerful that you want to get them right. So you can come up with a theory, but just like you said, Devaki, we don't know, is DHEA going to follow the estrogen pathway, or is it going to follow the androgen pathway?
Right.
We want an adequate amount of DHEA itself. So the bottom line is testing. So if you really want to find out if what your theory is working, you do a 24-hour urine hormone test while you're taking the hormones that you're taking, the DHEA you're taking. But I never think of it that way. I want to replenish the parent hormone. I want to replenish testosterone directly. I want to replenish it directly in women. I want to replenish it directly in men. I also want to have decent DHEA levels, but not with the intention of producing the downstreams.
Hey, and what happened when you were gone? What happened? What happened there?
Well, I rebooted my computer. I got this
When
error.
in doubt, reboot. If only the planet could unplug itself for 15 seconds, plug itself back in, reboot.
Idea.
Reboot's a great thing. Reboot is a great thing. That's why detox. You were going to talk about detox.
Well, I wanted
you could think of detox as a reboot.
I wanted to talk about, given all that I knew, it always comes down to the individual and the risk benefits. And when my 87-year-old mother was losing her cognitive ability, I leaned in the direction of giving her estrogen. That's for sure. Even knowing, and she couldn't do topical. I've only treated one person in my entire 28-year career with oral estrogen. And it was my own mother, because she couldn't handle the topical. She had gone too far down the
what would happen when she took the topical?
She got some benefit because I also gave her testosterone, and she was able to drop her cane. And she got about another year without the cane, and then the cognitive, it was a little too late. I also treated my mother-in-law at the age of 86 who had 3 MIs and 3 bypass surgeries. And she fell. She had horrible sarcopenia. And she fell, and she fractured her hip, her humerus, her clavicle, and she was in rehab for 3 months. And you know what? We have a video of her sitting on a low couch with her arms up like this and standing up off that low couch. Not a lot of adults can do that, let alone an 86-year-old woman. So you always weigh the risks and benefits for every single patient.
But here's the deal. Here's a woman that you've helped. She got rid of her cane, or she can stand up from a low stand without using her hands. Most people in their 40s and 50s can't get out of those couches anymore. And yet cardiologists, I was just lecturing at a conference called Epic, and the cardiologist there, I was sending him, he's a brilliant cardiologist, but I was sending him a number of my patients, and he kept taking them off of hormones because they think of hormones as being procoagulative, as dangerous on the heart, and they think of them as contraindicated. They do not understand hormones, and they unfortunately try and take patients off. So the problem is the benefits of hormones are so far reaching in ways that standard of care does not recognize. So patients and humans miss out. But it really, there is no age limit, and there often is no even disease limit, from breast cancer to heart attack to stroke. But you have to work with someone that knows how, which brings us back to wanting to create that board certification program to educate docs. Yeah, we've got to do that.
The whole world of treating women and men got so stunted by the WHI. Other branches of medicine were forming specialties, not menopause. Everyone got scared.
Or andropause,
and it was false.
Right.
But you know what? We're over our time, and I've got another commitment.
No. Oh,
so
you do?
Okay. Of course, I look forward to the next time we get to do this as frequently as we want. I love these conversations with you. And if you all want us back, just let us know. But I'm going to ask Devaki back as soon as she's willing.
You like chit-chatting with me? Will you do me a favor? Will you send me the link to this? Because I have a friend that's driving here tomorrow, and I would love him to listen to this.
Sure.
Can
Absolutely.
you do that? I would love that.
I will.
That would
send you
put
that
a
link.
Smile on my hormonally balanced face.
Yeah, this will be posted on our Facebook page, and I'll send you the link to that.
Okay, and it was a wonderful audience. Thank you all for participating and asking questions. And I'm so glad you're in my life and you're in the world. And we're getting older, and I feel like I have a fire in my belly and under my butt to try and get all these things done so we can pass this on, and we will contribute to a form of medicine where less patients will miss out. Less people will miss out, and gerontologists will realize there's other tools with which to protect the brain. Oh, well, thank you so much. But I love you, David. I really, when I had breast cancer 30 years ago, you were one of my doctors. So we've been through many journeys together. I had breast cancer 30 years ago, and I've been on hormone replacement for 26, 27 years now.
You're looking pretty good for being 52.
God, 52 sounds like a guppy.
You're not 52. Why I say that is because everyone should get a good look at you and ask, what is she doing?
I had Dr. McCullough on my show, and he said, did you have COVID? And I said, yeah. And he said, what was it like? And I said, well, I did ivermectin, hydroxychloroquine, the nutraceutical packs. It was nothing. It was just nothing. And he said, well, that's because you're in your 40s and young people don't get COVID. I said, oh my God, you've made my year. Anyway.
So good to see you, and I look forward to our next time. And thanks so much. Thanks so much.
Okay, blessings. Keep doing the good work that you do. We're lucky that the Kabbalah says that at any given time, there's 36 true mensches that are walking this planet. And I believe that I honestly do. I'm not, brown nosing or anything like that. I really believe you to be one of those true mensches, David. So thank you for being in our lives. Bye-bye.
Bye-bye, dear.
Blessings.